The next question is on healthcare. If block granting, which turns control of the Medicaid program to states and caps what the feds spend on it each year, becomes a reality for New Mexico, describe how the governor's office will prioritize adequate funding for Medicaid programs. Congresswoman?
The proposals at the federal level aren't quite block granting, but it's the same effort. It's intended to reduce dramatically any kind of Medicaid spending in states for health care. Quite frankly, Republicans in Congress are looking to trim $1.7 trillion out of health care spending, Medicare, Social Security, Disability, and Medicaid. And we're going to do everything we can while I'm there through December to prevent that, but I think that there is a strong possibility that this president and this administration will do everything in their power to minimize having available Medicaid funding. So what do we do about that? The first thing that you do is this governor has left millions of dollars of Medicaid funding on the table, which can be used to shore up our healthcare infrastructure, which if we do not do, the opportunities for creating a healthcare delivery system that protects every single New Mexican are minimized. So leverage every single dollar, including the provider assessment idea, which is a fee that goes to Medicaid providers, largely hospitals, so that that money goes back into those hospitals, particularly rural hospitals that are really struggling. This governor vetoed that. It was a bipartisan measure. I absolutely would not veto that, and did successful work in exactly that regard when I was the Secretary of Aging and the Secretary of Health in New Mexico. 2, begin to look at ways to increase your public health investment. We have eroded our public health investment, which means we do no prevention or primary care. 2, coordinate our efforts with our community health centers. 3, have a regional service delivery plan. And 4, I think Medicaid buy-in and the New Mexico Health Security Act have real potential for creating a delivery system that would really make a difference. Sometimes what's our Achilles heel, that we're only 2 million people, here could be our greatest strength by providing state-of-the-art quality health care to every single New Mexican. Health care should be it should be a right. It is not a privilege.
Senator Cervantes?
There was a suggestion earlier today that there hasn't been enough discussion about small business, and I am the candidate running for this office who's been in small business for 30 years and built a number of them. The first check I wrote as a small business person was to pay for the health care of my one employee. I started with one. And the first check I wrote was to make sure that when I promised her to join me and leave the largest law firm in the state to start my little practice, I told her I'd take care of your family, I'd pay for your husband and your children's health care, and I have for 30 years. Part of our problem when it comes down to the federal government dialing it back, and I agree with this Congresswoman, we know this president, we know this Congress, they're most certainly going to do so. Right now, New Mexico receives a match of $4 for every dollar the federal government puts into our Medicaid funding. It's become a critical part of how we fund medicine in our state. What hasn't been mentioned in the other questions or the other answers is how do we reduce the costs of health care? Right now, we have too much of a profit motive-centered delivery of health care, and the profit comes from delivery of health care as opposed to prevention. We need to be placing much greater focus in our health care and deliveries and rewarding health care providers for preventing the need for health care, and that'll bring down our costs. And so that will ultimately mean a better environment for small business people like myself who are paying for our health care, for those of you that are paying for your own health care and your own insurance, and it'll ultimately make us much less reliant on the federal government. Look, once in a while we have to give people credit, even when it hurts us a little bit to do so. Governor Martinez has done one thing that I can think of right during her administration, which is she approved, against the wishes of her own party, she bucked her party to enroll more people in Medicaid in New Mexico. She recognized the importance of Medicaid in New Mexico and to New Mexicans. She deserves some credit for that. Now we need to build upon that commitment. We've enrolled more people, we've insured more people. It doesn't do us any good to do so, to enroll them, give them that promise and that opportunity in children and seniors, and then not fund that care and make it available to them when they need it.
Mr. Apodaca?
Bottom line is 52% of New Mexicans live either on Medicaid or Medicare. We've expanded, it's a great program. But we've become dependent on it. And now we're dependent on the federal government. So what my opponents don't want to talk about is how we can grow opportunities. Because of our fighting between the legislature and our governors, we've actually have passed on Medicaid funding for Medicaid in this area of about $225 to $250 million annually. Folks, we got to get somebody at the governor's office that's going to work together and solve our problems. So that's the first step. The second step is we have to take a look at our costs. Now, yes, believe it or not, I have worked for small businesses and I have worked for companies, big and small, and I've built those. And 38 years ago or 32 years ago when I started in the business, the average cost per employee was about 8 to 10%. Today, it's about 37, 38%. I'm an independent contractor. I consult. I'm a cancer survivor of 38 years. I have twin boys that are 10. I literally pay $23,000 a year out of my pocket for healthcare costs I never use just to protect my family. The average New Mexican family can't afford that. We never talk about prevention. We never talk about lowering costs, and that's what we're talking about. But we also have to invest and grow jobs and grow the economy. What my opponents don't want to talk about is how we've lost over $700 million in tax revenues because we lose 146,000 jobs and 57,000 New Mexicans leave our state. You lose tax revenues. Our jobs plan will grow the economy. That will also help grow funds and Medicaid funds and matching funds. And then we can also lower costs with pharmaceuticals and also pay our doctors a higher fee to keep our doctors here. So go look at our plan, apo18.com, and go to look at our health plan. It's literally laid out how we're going to lower costs while we get more Medicaid and expand this to a single payer system.